I'm Tara Campbell, Loan Officer with Finance Fund. Finance Fund is a statewide, nonprofit financial intermediary bringing financial resources to urban and rural low-income communities through a wide range of funding programs. One of our funding programs is the Community Health Loan Fund, which was developed to expand healthcare access for disadvantaged people by increasing the number and capacity of health and wellness centers in Ohio, especially in rural and urban areas where fewer healthcare centers are located. Finance Fund developed the Community Health Loan Fund after working with providers, funders, and strategists in the healthcare sector who described the need for flexible financing for health and wellness facility expansion, renovation, and equipment. With the recent expansion of Medicaid in Ohio, the number of patient visits is expected to increase. The Community Health Loan Fund is a financing tool that can expand health and wellness centers to keep pace with their growing client base. Eligibility for the Community Health Loan Fund is very broad and includes all health and wellness providers who serve or wish to expand services to low-income people in medically underserved areas. Eligibility is not based on the type of provider that you are, but the population that you serve. Here are a few examples of eligibility questions we are often asked. So, what exactly is a medically underserved area? This is an area that has too few primary care providers or health services to meet the needs of the population. These areas often have high infant mortality, high poverty, and/or a high elderly population. To be eligible for the Community Health Loan Fund, the borrower does not have to be located in an underserved area, but must provide services to patients in a medically underserved area or who are low income. A borrower does not have to be a nonprofit organization to be eligible. The Community Health Loan Fund is designed to provide financing to a broad spectrum of health and wellness providers, ranging from doctors and dentists to nutrition counselors, as long as they are serving disadvantaged patients, low-income populations, and/or Medicaid patients. Dental equipment is an eligible use of loan proceeds from the Community Health Loan Fund, as long as the borrower has an established financial history and is serving disadvantaged clients, low-income populations, and/or Medicaid patients. Machinery and equipment are eligible uses for the loan proceeds as well. To reiterate, as long as you are serving disadvantaged clients, low-income populations, and/or Medicaid patients. Federally qualified health centers are eligible for the Community Health Loan Fund because they serve low-income people. Eligible uses of loan funds include machinery and equipment, building acquisition and/or renovation, as well as leasehold improvements. I'd be happy to answer any of your specific questions regarding eligibility. Please feel free to contact me should you need additional details. Ohio Medicaid expansion has the potential to provide health coverage for 270,000 previously uninsured residents. So now is a great time to expand your practice. It is important to know your options and understand the various financing tools available. Grants are always the most popular source of funds for expansion or equipment purchase, but the amount of grant funding is dwindling at a time when competition for grant funds is increasing. And not all debt is bad. Some community health and wellness centers prefer to borrow capital for expansion and save their cash on hand for operating reserves. As you look toward sustaining and growing your practice, you may want to consider a combination of both grants and loans. There are a lot of resources available to you. For example, the Ohio Development Services Agency's Ohio Vacant Facilities Fund provides a financial incentive to businesses that create jobs in vacant buildings and business parks. Many healthcare and wellness centers have discovered the advantages of using the incentive to turn vacant buildings into health and wellness facilities. As a nonprofit, our goal is to work with each borrower on an individual basis to address their specific financial situation. We offer this technical assistance as a way to determine the best rates and terms for each borrower. Typically, our loans range from $200,000 to $400,000 and offer a competitive yet fixed rate. The maximum loan term is 10 years for long-term fixed assets and up to 25 years for owner-occupied real estate. For collateral, we generally require a first lien on assets funded with loan proceeds. This means Finance Fund will hold a legal interest in the asset that is funded by the Community Health Loan Fund. For example, if the loan dollars are used to purchase medical equipment, then that medical equipment will be used to ensure that payments are made on the loan. If non-payment occurs, Finance Fund has the right to reclaim the equipment. We will consider a shared lien or a subordinate lien position for qualified projects, which means we would be willing to defer the collateral or share the collateral with another lending partner if it was necessary to make financing for the project work. As a general rule, borrowers must contribute 10% of the purchase price and/or project cost as an equity down payment. Therefore, if the loan request is for $100,000, then the borrower must demonstrate the availability of $10,000 toward the project. Are you eligible to apply? Great! Let's begin by taking a look at the Community Health Loan Fund application. You can find the application on Finance Fund's website, www.financefund.org. Just click on Funding Programs at the top of the homepage, then Loans. You will see a link to the application under Community Health Loan Fund. Print it out, grab a pen, and let's get started. I'll walk you through several sections and explain some of the terminology and information you will need. The first portion of the application, pages 1, 2, and most of 3, is just general contact information about the applicant, which is our borrower, and guarantors, if applicable. A guarantor is the person or entity that agrees to be responsible for the repayment of debt if you fail to pay or perform as agreed. Remember, a guarantor isn't always needed. You will see questions about the borrower's current banking relationship, as well as your organizational structure and ownership. Section A is where you will input information about the project. Simply stated, this is where you will tell us how much money you're requesting and what you will be using the money for. The project source of funds chart is where you will list how the project will be paid. This can be loans, grants, equity, cash, tax credits, etc. Next is the project use of funds chart. This is where you will itemize the total project cost, how the money will be spent, i.e., on a building and/or land acquisition, renovations, machinery, equipment, working capital. Remember, your project sources will always be equal to your project uses. We need to understand how the entire project will get done, not just the portion that our loan funds will support. You should complete Section B only if you are a community health center. The majority of this requested information can be transferred to the application directly from your most recent UDS report. Section C digs into the financial history of the organization. Your accountant, CFO, or bookkeeper will be a great resource to help you gather the required financial statements. Keep in mind that your historical tax returns, income statement, balance sheet, accounts payable, accounts receivable, and aging reports must be sent as an attachment to the application. This section of the application will ask you to explain any significant changes, either increases or decreases, in revenue, expenses, debt, and/or fixed assets year over year. Section D is where you will highlight the anticipated social impact this project will have on the community that you're serving. The final pages are certifications and signatures confirming the information you've provided is true and accurate to the best of your knowledge and that you are able to apply for this loan on behalf of the organization. Lastly, we leave you with a short checklist of required documents that should accompany your application and a reminder of my contact information. And there you have it, a completed application for Finance Fund's Community Health Loan Fund. Just mail it to my attention. And please don't hesitate to contact me if you have any questions about the application or would like to discuss the loan process in more detail. I am more than happy to schedule an appointment to assist you in any way that I can. Now I'd like to give you an example of a healthcare provider that is a Community Health Loan Fund borrower. Lower Lights Christian Health Center is a federally qualified health center that provides medical, behavioral, health, spiritual care, vision, pharmacy, and nutrition services to residents of a low-income neighborhood near downtown Columbus called Franklinton. This health facility opened its doors in 2002 to meet the healthcare needs of this urban neighborhood in which 45% of families with children live below the poverty level. Lower Lights is the medical home to around 8,000 patients. Last year, they provided over $350,000 in unreimbursed medical care to uninsured and underinsured patients, which is about 75% of their patient population. Finance Fund provided a $305,000 loan to Lower Lights to buy dental equipment needed to add dental services to its list of whole-person healthcare services. Dental services will include a full spectrum of preventative services, including cleaning, x-rays, fillings, and extractions. A limited spectrum of restorative and emergency services will be available as well. This dental program will include services to all ages, infants through senior citizens, and as with all Lower Lights health services, all patients will be provided care regardless of their ability to pay. As a result of Finance Fund's investment, the facility will hire 3 people and serve an estimated 2,400 patient encounters during the first 12 months of operation. Finance Fund is proud to partner with public and private investors to create the Community Health Loan Fund. Thank you for your time today. We appreciate your interest in the Community Health Loan Fund. I'm available to discuss potential projects, and please feel free to contact me with any questions you may have. We look forward to partnering with you.